Good afternoon, ladies and gentlemen. Welcome to Global Compliance Panel live webinar on Excel Spreadsheet validation for 21 CFR Part 11. My name is Johnson and I'm going to be your host today. On behalf of Global Compliance Panel team, I would like to thank you for being a part of today's event. Today's webinar will be presented by Ms. Angela Bazigos. Ms. Bazigos is the CEO of Touchstone Technologies Silicon Valley Incorporated, your passport to compliance. She has 30 years of experience in the life sciences industry, spanning project management, quality assurance, and regulatory affairs, and has a patent aimed at speeding up software compliance. Ms. Bazigos is a member of the Society of Quality Assurance Computer Validation Initiative Committee, ASQ, DIA, and RAPS, and consults to investment groups on life sciences investments as well as pharma, biotech, medical device companies on compliance matters, including strategy, submissions, quality assurance, and remediations following action by the FDA. Ms. Bazigos teaches classes on compliance, 21 CFR Part 11, Computer Systems Validation, and Project Management, both to investor groups and industry. More recently, Ms. Bazigos co-authored Computerized Systems in Clinical Research, Current Data Quality, and Data Integrity Concepts with FDA, DIA, and academia. She is on the board for UC Berkeley's Business School for Executive Education in Life Sciences and on Stanford Who's Who Registry for contributions to the life science industry. We are honored to have such a distinguished person such as Ms. Angela Bazigos with us to present today's webinar. Before we begin, I would like to inform you of the program outline for today's training session. This webinar is for 2 hours. First, Angela will take you through today's webinar, highlighting the areas that will be covered, and she would then share with you her presentation. We'd like to inform all our participants once part of the teleconference have been placed on mute and will remain so until the Q&A window begins towards the end of the webinar. We also request all to hold back your questions until the Q&A window begins. 10 minutes of time will be allotted for the Q&A, during which your questions will be answered. If for any reason you do get logged out of this training session or teleconference, please follow the same procedure to join in again. Now that we are all ready to start, I would request Ms. Bazigos to take it from here. Angela?
Hi, thank you, Johnson, and good morning, everybody, or good afternoon, depending on the time zone that you're in. I hope you can hear me okay, and you will be able to see the slides moving forward okay. If not, please let Johnson know. He will be able to help you. And as Johnson said, my name is Angela Bazigos. I am the CEO of Touchstone Technologies Silicon Valley. We call ourselves your passport to compliance, and I am hoping that today's presentation will be another tool in your arsenal to achieve compliance. The contents of this class, we're going to start with why we even here this morning or this afternoon. Then we're going to go over some definitions so that we're all on the same page or use the same terminology when we're going through the presentation and we're all speaking the same language. Then for those of you who are like me, who does not remember exactly all the types of spreadsheet applications that you can have, I am going to give you Spreadsheet Applications 101, and I will take about 5 minutes to do that just to make sure we all know what we're talking about again. Then we will talk about FDA's expectations for spreadsheets. This is 21 CFR 1110 compliance, not the rest of Part 11, even though we will talk about how to address that. And we're going to start with a short program, if you like, on the 21 CFR 1110, which will be B2K. And after that, we will take a 5 or 10 minute break, depending on the time. After this, we will address the bulk of what needs to be done for 21 CFR Part 11, which is Part 11A, and that will be the Computer Systems Validation, CSV. As Johnson mentioned, then we will have some Q&A, and please hold your questions until that time, if you would. Okay, well, let's start off with why this class. I mean, why do we even want to have this class? We've been using spreadsheets forever and a day, haven't we? In any kind of business we've been in, we've been using spreadsheets. And, you know, we have been happily using the results to make important business decisions. And whether we started in the regulated industry or not, we are now using our spreadsheets in a regulated environment. So what's the problem? Well, spreadsheets were not designed to be used for a regulated environment. So if you have them as they are, you're going to run into a lot of risks. So in the interest of full disclosure, I have to tell you that my company helps the FDA with a lot of the regulations. We particularly work very closely with Bob Tollefson, who is the computer guy at the FDA. And whenever we have lunch with Bob or some other discussion, sooner or later the discussion turns to spreadsheets, and we all have a good chuckle. Or rather, Bob Tollefson from the FDA has a good chuckle, and the rest of us pretend to be having a good chuckle because spreadsheets are what is called a low-hanging fruit for inspections. It's really easy to get spreadsheets wrong or to not do the right thing. So this is why we're having this class. And I will take Bob's name in vain every so often in this presentation because he can occasionally have strong opinions which unfortunately are always correct. So I'll try to give you a little bit of his wisdom in this presentation. Okay, so given that spreadsheets are not designed for the regulated environment, and now we have a compliance problem, what are the ways to resolve or reduce the compliance problem? Okay, well, you could always use different software. You don't have to use a spreadsheet, but you could use different software. However, I'm assuming if you're in this class, you're not in this class because you're trying to use different software. Yes, Johnson, did you want to say something to me? Okay, no worries. The other one is to change the way that spreadsheets are developed and used, and apply all the functions of the spreadsheet to increase the level of compliance. So this is where this class is targeted. There are add-on software packages that better enable users of spreadsheet programs to comply with regulations. Okay, I have to give you a huge caveat here. In past presentations, the attendees have said, okay, so what add-on can I buy to make my spreadsheets compliant? No, that's not how it works. You have to buy several add-ons, or you can only make one or two pieces of the spreadsheet compliant using add-ons. In order to make the spreadsheet compliant, you have to follow everything in this presentation. And I had one attendee once after I gave this presentation, and I was so happy with myself. I thought, great, you know, another good presentation. I'm so happy that people will know and Bob will not get upset about these guys. And one attendee says to me, okay, but what do we need to do to make spreadsheets 21 CFR 11 compliant? And I was stumped. I said, well, we just went over it for the last 2 hours. So I want to make sure to set your expectations. I want to make sure to set your understanding. Everything in this presentation will need to take place in order for spreadsheets to be 21 CFR 11 compliant. You can buy some add-ons, or sometimes you can develop them yourself. I'm just not a developer. You can buy some add-ons for pieces of the spreadsheet so that, especially audit trail, you know, I want to leave you in suspense. Especially audit trail is something that you can buy add-ons for, and our company can you still hear me, Johnson? Hello?
Dear attendees, we are
Create and implement the spreadsheets, and just one moment, I want to pick up the pointer. You can have add-on software that makes some compliance with Part 11, and this is usually specific to audit trail. It's not everything, and I was trying to make a point that in past presentations, people have thought that you can just buy something and you plug it in and everything becomes Part 11 compliant. That is not the case. You have to do everything in this presentation to make them Part 11 compliant. The other way to do it, of course, is to start with some software that's Part 11 compliant. I don't know, say PK software like EP or Thermos version, which is Kinetica or WinOnLin, and then use Excel as a plugin. Anything that you do, you still need to do number 2, which is make sure whatever you do with your spreadsheets, you apply all these principles to make them Part 11 compliant. Okay, let's talk about some definitions, and again, this is what we're going to use in this presentation. I'm going to be using the word add-ins, and these are modules that can be installed or downloaded to provide optional commands and features. And for example, if your spreadsheet is Microsoft Excel, things like Solver and the Analysis Tool Pack are add-ins. Also, if you buy the add-ins for Audit Trail, that's going to be an add-in. Calculation. I'm going to use this to denote any mathematical or logical operation performed by the spreadsheet. When I say FDA, I will mean our beloved agency, the Food and Drug Administration, but also I mean any other regulatory agency. The FDA tends to be a leader in regulations, and most other agencies work somehow to do what the FDA does. And of course, there's the International Council of Harmonization that makes sure all the agencies, or most of the high-rated country agencies, follow pretty much the same thing. I'll say formula to mean a type of calculation that comes with a spreadsheet, and I'll say macro to mean a type of calculation that's defined by the user. I'm going to be using Excel as the generic spreadsheet application, but every so often something might be different in a non-Excel spreadsheet, and where I can and I'm aware of this, I will point that out. But we're going to be using Excel as the example. In Excel, a workbook is the entire spreadsheet, which is the entire Excel file, and the worksheet is an individual page within the workbook or the spreadsheet, and in Excel you can see them as tabs at the bottom of the spreadsheet. Okay, and here's spreadsheet functionality 101 to make sure we're all on the same page as to what spreadsheets can do. And there is 4 different types of spreadsheet applications. And I'm not going to read these slides. You can get them off the help function from Microsoft Excel. I'm just going to give you the salient points. So the 4 types of spreadsheet application that you can have, and this is in addition to your vanilla, garden variety Excel. They are data form applications, worksheets with form controls or ActiveX controls, and I'll go over the distinction for those. You can get more sophisticated and use drawing tools and the associated objects, or you can use Visual Basic user forms. Those are the different types of applications you can have. I'm not going to talk about the one that you just open Excel. I'm going to talk about these different forms that now become applications. Let's look at the data forms. Okay, so a data form is just a convenient way to enter or display a row of information. I'm sure you're all familiar with the way Excel displays things. It looks like a crossword puzzle. It just cells, lines that are horizontal and vertical, and that's basically how it presents the information. That's probably 99% of the way that we use Excel. However, if you are using it for more than just a transient function or information, you might want to add a data form. And you can see a data form starts to look a little bit like a real screen. Instead of having customer ID and company name just written at the top as a row header or a column header, you can now actually create a nice little form, that the user can use. This is especially useful if you have non-sophisticated users and you want to make sure they only use a couple of the functions on the screen and you can lock everything else out. If you want to get a little more sophisticated, you can use form controls or ActiveX controls. Now, what's the difference? They're very much the same, by the way. Most of us are probably familiar with ActiveX controls. quite often when you have a website or it says you need to enable ActiveX controls, otherwise it will not do the pop-up. And this is what we are used to seeing a lot of. However, if you use Excel version before 4.5, before version 5, instead of ActiveX controls, you would have form controls. That's basically the difference. And if you have form controls, you can see you have some of the functionality. But those of you who are like me and have been in the industry since the dinosaurs roamed the earth, you might recognize this as a little bit dated looking, not that sophisticated. Certainly no teenager today would look at this and think that this was a real computer application. ActiveX controls start to get a little bit more sophisticated. This is the same information as the previous screen, but you can see there's a little bit more functionality and it's just a little bit better in terms of ActiveX, in terms of the control. However, the nice thing about ActiveX controls is you can also have drawing tools added to them. So instead of looking like the previous screens, and again, self-respecting teenager would recognize as real applications, now you can start adding other things like graphics and drill downs and et cetera, et cetera. That's where ActiveX controls really helps you out. And last but not least, you can go wild. You can build anything you like using Visual Basic user forms, and this is a programming language that you can treat Excel like any other application, make it very sophisticated, make it very user interface friendly, et cetera, et cetera. These are all the things you can do in Excel. Plus, you can have your basic crossword-looking Excel spreadsheet. So this is what I wanted to give you very quickly. This is what the sort of applications you can create with Excel. Okay, having said that, what are the FDA's expectations for design and use of spreadsheets? Why does Bob chuckle when we talk about spreadsheets? What is it about Excel that gives him such mirth? Well, first of all, any spreadsheet containing GXP or quality data must be compliant with 21 CFR 11, and the data within must be controlled. This is a small sentence with a big meaning. Most people do not realize that they have spreadsheets that should be controlled, and whenever I audit companies, I see a lot of spreadsheets that should be controlled that are not controlled. And there's usually some validation consultant somehow, somewhere, that erroneously informed the company that, oh, this spreadsheet does not need to be controlled. And those are easy to find. They tend to be very similar from company to company, even if you're one of the newer type of companies like genomics, diagnostics, or even the network signaling diagnostic type companies. We know where to find these things, okay? Mostly for spreadsheets, we are interested in 1110. It's not my intention to teach you 21 CFR 11 in this presentation, so I will let you look up 11, 30, 50, 70, et cetera, et cetera. I did not number these things, by the way, so I don't know why they're numbered the way they are, but this is basically what we will focus on. Let me take a step back here and give you a couple of pieces of information that you may or may not be aware of. We've all heard of 21 CFR 11. What the heck does 21 CFR 11 mean? In case you're not aware of it, CFR stands for Code of Federal Regulations, which is an enormous book. It's actually a sets of volumes, or it's like Encyclopedia Britannica for those of you who, again, have been around a long time and remember the encyclopedia salesman who would come to your house and then they would sell you this nice little bookshelf that would have two shelves, top and bottom, and on each shelf you would have 20 volumes, and the top shelf you would have volumes A through M, and the bottom shelf you would have N through Z or Z, and anything you wanted to know about the world would be contained in those volumes. Clearly this was before we had internet. We had nothing better to do but look up Encyclopedia Britannica. Now this is what Code of Federal Regulations looks like, except it's many more volumes than just the two shelves. So 21, so then these volumes, just like Encyclopedia Britannica had, volume 1 is Aardvark through, I don't know, something, Azores or something. Each volume is headed with a number. This is the government. So volume 21 is the Food, Drug, and Cosmetics Act. So this is why we say 21 CFR. Basically, we say the Code of Federal Regulations, volume 21. Part 11, and then we have things like 11, 58, 820, 300s, like 312, 314. We have 211 to 12, 1260. I mean, all these are, I think of them as different chapters within Title 21, and Part 11 is the computer systems validation and other computer-related stuff. Now, what most people do not realize, and this is a common misconception, is all the predicate rules, and there's different definitions of predicate rule. I just say predicate rule, if it's not Part 11, it's a predicate rule. So all the predicate rules somehow, somewhere allude to Part 11. And sometimes citations from the FDA come from Part 11. Sometimes they come from a predicate rule pertaining to Part 11. And this is really hard, and this is a complete different presentation. Okay, so Part 11.10, persons who use closed systems to create, modify, maintain, or transmit electronic records shall employ procedures and controls designed to ensure the authenticity, integrity, and when appropriate, the confidentiality of electronic records, and to ensure the signer cannot readily repudiate the signed record as not genuine. What does this mean? Well, it basically means they need to have some confidence in the records, and they use these controls to be able to look at your records and say, yeah, great, we believe this company's records. The FDA has stepped up 21 CFR 11 enforcement since the late 2010. Also, in the interest of full disclosure, like Johnson said, I am now the president of the Pacific Regional Chapter of the Society of Quality Assurance. We are working with the FDA to help them have even more enforcement of 21 CFR 11, and Bob Tollefson is delighted, and we are actually including all countries, including Pacific Rim, and we're reaching out to the other chapters across the country because I really believe in 21 CFR 11, and I will tell you why in a little bit. So I said that people are not aware which spreadsheets should be compliant. Let me give you some rules of thumb. First of all, any spreadsheets that control GXP data. GXP data, anything that's clinical, laboratory, medical device, manufacturing, etc., that's GXP data. Also include quality assurance data, and here's a little bit more information. You can say any spreadsheets that are used to make quality decisions. So whether you have documented evidence of SOPs, tracking logs, audits, approved supplier lists, approved batches, etc., etc., all those are spreadsheets that are used to make quality decisions. Now, even if it does not fit in the previous two examples, but the spreadsheet data will somehow worm its way into a regulatory submission, then it needs to be controlled. And I have had clients, and this is one of the things we were talking about with Bob, that had a spreadsheet that created a supplier list, and they were using to track their suppliers. And then somehow, somewhere, the information from the spreadsheet found its way to a manufacturing sort of spreadsheet. So this company thought that the first spreadsheet, because it was not directly related to the submission, was not relevant and did not meet Part 11 compliant. I actually talked to Bob specifically about this client. And by the way, like I said, our company works with the FDA a lot, but we never give the name of the client to the FDA, even though the FDA would like us to, but we cannot do that. We have sort of attorney-client confidentiality, if you like. So that lets us be able to speak both to the FDA and the clients. So, however, in this case, even if it was not one of the two previous examples, you could say that really they were using the supplier list spreadsheet and that was compliant, but they had this spreadsheet that did not quite fit. But the data from the spreadsheet actually made it into the supplier list, and that needed to be compliant. The good news is nowadays you can use risk-based approaches for compliance. This is also out of scope for this webinar. However, whatever I say this webinar, you can mitigate somewhat with risk-based approaches. Okay, so take another step back. How would your company meet 21 CFR 11 expectations, given that the FDA has all those expectations from the spreadsheets? And this is sort of taking a step back and also jumping ahead a little bit, because I want to say that Part 11, and this includes spreadsheets, is not an IT function. It's not a single person function. It's not just something that happens in the background. This is a company-wide effort. And in that vein, and it actually makes spreadsheets a lot easier. It's best to develop, communicate, and enforce a company policy and master plan for spreadsheet applications, calculations, etc. Then you need to prepare an inventory list with all the computers that run the spreadsheets. I recommend that you standardize development and use of spreadsheets as much as possible. Cookie cutter, you don't have to reinvent the wheel every time. You can reuse as much as possible. Protect spreadsheets using built-in standard software and IT infrastructure, and we'll go into this a little bit more, but think of it as a global strategic activity, not just as a tactical activity. Also, as a global effort, I suggest that you validate the spreadsheet calculations so people can reuse them. And anything that you do, document, because as you all are aware of, I'm sure, as the FDA says, if it's not documented, it did not occur. And you can do anything you like. If it's not documented, it isn't valid. And of course, if you do anything that's outside of the regulations or even inside the regulations. Make sure you justify your approach and explain your decision-making process. So what are the requirements for 21 CFR 11A? Sorry, 21 CFR 1110. So these are the, if you remember, we said 21 CFR 11 is now a chapter of Title 21. 1110 is closed systems. Closed systems means just systems that you use inside your company. Pretty much most of the things that you will use are under 1110A for spreadsheets, and like I said, this will be the second part of our presentation. However, all of these, B through K, and all the other 11 Part 11 sections can actually be put under 1110A, and I will explain this later. However, let's look at 11B through K. So 1110B says accurate and complete copies of records. 1110C says protection of records. D, limited system access. Notice there's a little bit of duplication here. They are slightly different, but sometimes even I can't tell the difference, and I've been working with the FDA on Part 11 since 1990, and you know, it's a government, you know, there is some duplication. Audit trails, this is a part of 1110A, and often people say to me, yeah, we have to be Part 11 compliant. That means audit trails. Yeah, well, it means audit trails. It means a whole bunch of other stuff, too. You know, it's not just audit trails. Operational system checks, authority checks, and I'll go through all of these in detail in a minute, and I think we'll still be able to have a break at exactly on the hour. Device checks, training. Training in Part 11, but we have training in pretty much all the predicate rules. Yeah, you know, there is duplication between Part 11 and the predicate rules too, not just inside Part 11. We like duplication in all sorts of places. Electronic signatures and control over system documentation that you will also find in the other predicate rules. And with that, let's look at Part 11, B to K. Alrighty, so 1110A, well, we're going to look at B to K, and now she talks about 1110A. What's with that? This is so important that I am going to put it in this place, and I will also go through this in detail for 11 on the second part of the presentation. However, what I want to tell you is all the other parts of the rule can be assimilated into 1110A. That's part of the reason this is here. 1110A says procedures should be in place for validation of systems to ensure accuracy, reliability, consistent intended performance, and the ability to discern invalid or altered records. It still says the records are of good quality. Just because you have an older system or an existing system does not mean you can not do this. It applies to both new and existing systems, and it should include any application-specific functions, as well as functions related to Part 11, which are B to K, and all the other parts of Part 11. And that's how 1110A fits in. 1110B, accurate records generation. Procedures should be in place to generate accurate and complete copies of records in both human-readable and electronic form, suitable for inspection, review, and copying by the agency. Persons should contact the agency if there are any questions, or you can contact us and we'll contact the agency regarding the ability of the agency to perform such review and copying of the electronic records. So basically, the agency wants to be able to take your records and look at them themselves and do their own analysis and not just rely on your analysis. A way to implement that is to say spreadsheet AA is stored as an Excel spreadsheet template, which is both human readable and an electronic format suitable for agency inspection, review, and copying. This is tested implicitly throughout the validation, does not require explicit verification. But remember when I talked about your Excel master plan, you can put this information in there. This would be your documentation and a justification. One gotcha or caveat is at the time of the archive, the original electronic records should be archived with a paper records. Durable media can be used. And now, archival for accurate records generation is a whole other issue. And this will come up again later. It's not so much archival that's the issue, it's retrieval that's the issue. Because as technology changes, depending on how you have archived something, you may or may not be able to retrieve it. And one of the good things about spreadsheets is usually we will use spreadsheets to do archival that's durable, or comma delimited files as opposed to the original proprietary database files. That is the nice thing about spreadsheets. They actually lend themselves to good archival. Of course, there's also the question of durable media. And of course, the durable media is also something that has obsolescence as part of its life cycle, and you have to make sure that you keep it up, and whatever durable media you're using is still durable when you're trying to retrieve it, or the agency is trying to retrieve it. And just to say, the humorous aside, when I was co-authoring that book with the FDA and the DIA, we did some research about what was the most durable media that you could have that would last you forever. And apparently stone tablets are the most durable media. So you can put everything on stone tablets if you want it to last forever, or you can do periodic review of your durable media to make sure that the agency can still have accurate records generation as per 1110B. Protection of records. Records must be protected to enable their accurate and ready retrieval. What again? We just talked about it. Yes, this is the government, bear with me, but there are some different things here. Ready retrieval throughout the records retention period. So this is where, yeah, you generated the records, but how do you make sure, excuse me, that they stay generatable? There is many other things that you can do in addition to 1110B. You would have a backup and recovery SOP. You would have disaster recovery, data archiving, records retention SOP, change control so the records are not inadvertently changed, periodic review SOP. Remember I said you need to periodically review that you can still retrieve it. And by the way, if you don't have stone tablets as your storage medium, you want to make sure the technology is periodically reviewed. And your training SOP also comes in here, even though it comes in later as well in the training, to make sure that people know how to do all these things. Now, there is something that is really important about periodic review. Most of the, you know, when you audit enough companies, you kind of have a sort of sense of the recurring problems, if you like. And periodic review is often the recurring problem. They go into, we have to do all these other things. Say we do the backup and recovery. And, you know, we'll get around to periodic review SOP sometime in the future when we're not too busy. And you all know about the fabled copious spare time. And one of the audits I did, the company had a brilliant backup and recovery SOP. They were following it to the letter. They were really, really good, but they did not have a periodic review SOP, or I can't remember if they had one. It was certainly not being used. So all I had to do was check one thing in the backup and recovery. I said, would you back up this data? Sure, they back up, or would you run the backup function? Sure, they run the backup function. Good, now would you run the recovery function? Sure, no problem, they run the recovery function. I said, would you check that your backup and recovery actually give you the same results? Why would you want to do that? We know it works, just tested it. Okay, just humor me, I'm the auditor, auditors, we need to be humored every so often. They were losing about a quarter of their data. Because when they first started, and I'm just going to give you some example numbers here, they're not real numbers, they had said that when they started, they had what, a couple of kilobytes of data. So they thought 15 gig was enough space for the backup space. However, the data grew to 20 gig, and because they were not doing their periodic review, nobody knew about it. The person that backed up every night was happily backing up. They had not had to recover, so they did not realize anything was going on that was amiss. So this is why periodic review is so important. It's so easily missed, another low-hanging fruit for an auditor. Okay, limited system access. Procedures should be in place to limit system access to authorized users. You don't want your gardener or your nephew accessing the data, but you also don't want the system admin from the IT department accessing the study data. So you want to make sure that the correct people are using the correct data. For example, Spreadsheet, a way to implement this, Spreadsheet AA will be stored in network file location QQ, which is only, say, accessible to members of the QC group. Or you can have Spreadsheet BB, which is in read-only mode. And if the user needs to edit a spreadsheet, they need to print it to hard copy because it will not be saved. Or access spreadsheet through Spreadsheet CC will be through System RR, which requires username and password, or other security procedures. Now, some people think that you can put password on spreadsheets. Yes, you can. It is so easy to break that. You have, I am not particularly technical, even though my second degree was in IT, and I've been in IT 25 years. All I had to do was go online, get the little macro that breaks the password for Excel spreadsheets, and I was in. That's the bad thing about being an auditor. You come up with all sorts of tricks to get into people's data. So when you have your security procedures, it's not enough to say, oh, these spreadsheets are password protected. You need to do more than that. So, and all of these security procedures and how you're going to do that can be put in your master plan that we talked about earlier. Okay, audit trails, 21 CFR 1110E. It's not even at the beginning. It's kind of somewhere in the middle. Procedures should be available to use secure, computer-generated, time-stamped audit trails to independently record the date and time of operator entries and actions that create, modify, or delete electronic records. Record changes shall not obscure previously recorded information. Such audit trail documentation shall be retained for a period at least as long as that required for the subject electronic records and shall be available for agency review and copying. Long sentence, but it has about 3 messages in it. The first one is you have to have computer-generated time-stamped audit trails. That means if you're not going to use one of the plugins for the audit trail, then you need to use the computer to give you this information. For example, you can use a file stamp. You can create an Excel file and then put it in the user's directory because you want to know whose head is in the chopping block. And I'm sorry I'm being a little bit gross here. I just need to impress upon you that we need to know who did this, not just when it was done. Make sure the audit trail records are not obscuring a previous recorded information. So, because I've seen people write their own audit trail and each audit trail record replaces the previous audit trail record. That is not correct. You want it to be a new audit trail record, and I'll explain in a minute the advantages of that. And oh, by the way, it's not enough to retain the initial records for your retention period SOP. You also need to retain the audit trails. So the user independent computer-generated timestamp. There should be a link to the identity of the person who saves the record. Again, some audit trails can be satisfied procedurally, but not by someone writing things down. It's more a case of, like I said, you can use, if you're not using the plugins, or writing your own plugin. Please don't call me and ask me to write your own plugin. I don't know. But I had one person who asked me how to do that, and I said, I don't know, but when you find out, please let me know. What I can do is put you in touch with the companies that write plugins, and there's a couple that I can recommend, but I cannot tell you how to write it. I am not that technical anymore. Now, why do we need to keep audit trails forever? Well, actually, audit trails are very, very useful. It's not just that we know whose head is in the chopping block. I had one client who was working on a study, and for some reason, the study had been submitted to the FDA, and for some reason, well, it's not some reason, I don't know exactly what happened, but they ended up losing a lot of the data from the database without realizing they were losing it. And I was auditing them, and many times we audit somebody and then, because we just audit their QA, and then we end up helping with remediation. But this was one of the most urgent ones. What happened is I go in and I say, why is that happening? And they said, well, it's supposed to happen. We called the vendor of the system. The vendor said, this is the way it works. And I said, well, I don't care what the vendor says. That is not supposed to happen. And it turned out that there was a bug in the software, and they were losing their data. And of course, this has already been submitted to the agency. And then we go into this emergency mode where we recreated the entire study from the audit trail. We actually recreated all the missing data from the audit trail. And immediately upon finding the problem, we contacted the agency. We said, this is what's happened, and we're proposing to recreate it from the audit trail, and we will keep you posted at every step and let you know what we're doing. And the agency was actually happy with that, so they did not have to scrap an entire phase 3, 30,000 people study and have to redo it. So this is why audit trails are really, really useful. So if electronic data is not retained, for example, ways to implement it, spreadsheet AA is only used as a template, and electronic data entered into the spreadsheet is immediately printed onto paper. The paper document is then signed and stored. Aha, but, says Bob, you need to be able to verify that the data entries were not altered prior to immediately printing and signing. So this is something that Bob looks into. You also need some kind of SOP to show that you did not alter the data before immediately printing and signing. Some spreadsheets will produce an audit trail. And by the way, track changes ain't an audit trail. Audit trail is not something that a layperson should be able to alter either. Audit trail records need to be Part 11 compliant just as much as any other electronic records. Procedural controls, F, G, and H. What does this mean? Let's start with operational system checks, 1110F. Procedure should be available to use operational system checks to enforce permitted sequencing of steps and events as appropriate. Well, let me put it to you like this. When you make a cup of coffee in the morning, first you put water in the coffee machine, or you put coffee in the coffee machine and then put water, and then you press the on button. At the end of the day, before you press the on button, you have to have both coffee and water in the coffee machine. If you only put water, you're just going to end up with hot water. If you only put coffee, you will end up with a lot of smoke. So what this is saying is you need to have some kind of check that you don't only end up putting coffee or only putting water, that you are able to check and not move forward without having put both the coffee and the water in the coffee machine. This is also called workflow. And even though you have a lowly, humble, a little spreadsheet, it may have workflow. It often has workflow. This is the data that's going to come into it. And this is what we're going to do with the data. And this is how we're going to push the data out and send it to the next person to do their job. So make sure you have the correct workflow. Authority checks. Procedures should be available to use authority checks to ensure that only authorized individuals can use a system, electronically sign a record, access the operation or computer system, input or output device, alter a record, or perform the operation at hand. This is something, again, that you can have in your master plan. Basically, it can be things like badge access or username and password, or give 2 more forms of identification, like your mother's maiden name and your birth date or something like that. So you need to have some way to ensure that only authorized individuals can use a system, not your nephew or your gardener or somebody who will maliciously or inadvertently alter the data. Device checks. Now, this is not as common to everybody as it is in some more research instrumentation environments. Procedures should be available to use device, for example, terminal checks, to determine as appropriate the validity of a source of data input or operational instruction. What this is, first of all, back in the days before laptops, for those of you that remember them, we had devices attached to a computer. We had a screen or a monitor, whatever we called it, and we also had a keyboard, and we also had the mouse. These are examples. For those of you that use punch cards, we had those too. So those are all devices. We don't have to use devices such as monitors and keyboards. We don't really need to test those. However, if you have a computer talking to an instrument, and vice versa, obviously, you need to make sure they're talking to the right instrument, or the instrument is talking to the right computer. So let me give you a little bit of more detail how to implement these three. So, for example, if you have operational system checks or device checks, you can say you have SOPs, you have your workflow. For example, you can have a spreadsheet. AA input will be executed according to SOP input 003, input into spreadsheets. That's your workflow. Or for G, authority checks, and you can have data in spreadsheet BBB will be stored on the QC department, and they're backed up like with this SOP, et cetera, et cetera. Now, for device checks, you can either say, you can say beyond the keyboard will be implicitly tested. You can say it does not use any external data entry tool. However, if you are using external data entry tool like a keyboard, or if you're using an instrument like I mentioned, you need to have a list of the instruments the computer can talk to, and you also need to have a list for the instrument of the computers it can talk to, because you really don't want, like your mother said, you don't want them talking to strangers. It's kid rearing 101. You do not want to be talking to strangers. You have to make sure and test that it only is able to talk to those devices or computers on that particular list. And if anybody else tries to get it or somehow lead astray this instrument by requesting data when it's not on its instrument list, then the instrument will very politely refuse and alert an adult in the form of a system administrator to let them know that this happened, so the adult can follow up with that. Okay, training, and we're almost there. 1110I, procedures should be available to determine that persons who develop, maintain, or use electronic records, electronic signatures have the education, training, and experience to perform their assigned tasks. Every single predicate rule has a training requirement. At the end of the day, we have to be trained to do what we're doing. We can't just be doing something without the training, and you have to have the training record to show that you are trained for that particular task. It's also good practice to have a training, say all these people have to have X training, and then check if they have it, and if they don't, make sure that you make it available to them before they start doing the function they're doing on the system. Applies to Excel spreadsheets as much as anything else. It also applies to all kinds of users, not just to the user community. It applies to developers, support people, third-party vendors, part-time employees, external service providers, etc., etc. And one of my little pet peeves, and I see it over and over and over again, I'm seeing it right now with one of my clients, training often does not take very long. It can take 2 hours, it can take 2 days. And then you're fine. But what I see is a lot of companies say, well, we can't afford to train our developers. We cannot spend 2 days teaching them how to write this application. They have to learn on the job. I also do a lot of project management. I've been doing it 25 plus years. What I usually find, and I try to persuade the client to do training up front, but what I usually find is they don't train you up front. They don't spend the 2 hours training up, the 2 days training up front. So it's 2 days. It's usually not that long. But then they spend weeks and weeks and weeks fixing problems, calling a very expensive vendor consultant, getting everybody confused, undoing things. So one of my pet peeves, one of my soapboxes is get training as early as you can for all the people involved, and your project will be much more likely to be on budget and on time. Electronic signatures. You're not really going to do electronic signatures for Excel, are you? I hope you're all shaking your heads no. However, because it's 1110J, I'll just go through it briefly. And basically, procedures should be available to establish and adhere to written policies that hold individuals accountable and responsible for actions initiated under their electronic signatures in order to deter record and signature falsification. Now, electronic signatures, I just want to put a little bit of an explanation here. They're not that different to any other electronic signature. When you go to the supermarket, you run your credit card, and then there's a little pad, and you put in your electronic signature. No problem. For some reason, our industry is not that advanced yet. We pretty much use username and password. And for some totally obscure reason, people do not realize that electronic signatures have the same meaning as handwritten signatures. So in order to make them realize that, it's worth getting them to sign something that says, I understand that electronic signatures are legally binding and have the same meaning as handwritten signatures. Eventually, we will have the little pads or, retina recognition or something. But right now, we are using username and password. Also, this is not so much a problem in spreadsheets, but it is an issue in general, and maybe some spreadsheets. Vendors confuse electronic signatures with authentication. It's not the same. Electronic signature is a legally binding signature that gets sent to the FBA. Authentication is just username and password so you can log in. They look very much the same, I know. Okay, last but not least, before our break, system documentation, 1110K, not unique to 1110, but make sure you have adequate controls over distribution of, access to, and use of documentation for system operation and maintenance, and you have revision and change control procedures to maintain an audit trail of the documentation. Audit trail again, huh? This one does not have to be a plugin. You just need to make sure you are keeping track. Now, this includes all the lifecycle documents, records, protocols, whatever. Use your change control process, and make sure that controls are in place to ensure that only the most recent version of the document is used. Another audit or trick is you sidle up to this unsuspecting person who is shaking in their boots because and especially if they're young and they're not used to being audited, and you ask them what SOP they're following, and they show you the SOP that they have in their hand, maybe they've scribbled on it, and then you ask them, and then you ask the manager, is this the same as the master SOP that might be in your electronic system? And quite often, people have printed something out, the master record has changed for the documentation, and these people have not reprinted. So make sure you have some kind of control that says the printed version is only valid for, 24 hours, 72 hours, whatever it is. So people are not caught out with this. Alrighty, let's have a 5-minute break here since I had some delay, and I will try to bring this to close within the time. I feel like an airline pilot that had a delay leaving the airport, and now we are trying to make up time. So hopefully we will be landing at the same time. So Johnson, it's okay if we break for about 5 minutes here? How about 7 minutes? Yeah, so it's
sure thing.
Yeah, so I make it 11:18. This is Pacific. Let's make it 25 after. Let's all get back together. Okay?
Okay. Thank you so much, Angela. Yep.
Thank you, everyone. Everybody. So let's go back to 1110A. And I will repeat this part of the rule. Procedure should be in place for validation of systems to ensure accuracy, reliability, consistent intended performance, and the ability to discern invalid or altered records. Actually, before I even go to the next slide, most of you are familiar with testing of software systems. So you might, people say verification and validation, V&V, and I will even use V&V because it just sounds so cool. However, I need to make a distinction between verification and validation. And the way I will make that distinction is by giving a story of Peter Drucker. And for those of you who remember him, he was the father of quality management, and he actually brought total quality management to Japan before it was adopted in the U.S. So there was a U.S. company that wrote that was ordering something from Japan, and the U.S. company did not have Peter Drucker's total quality management. The Japanese did, and they used verification, and still a lot of companies use verification. I'm not saying that's a bad thing, but by using verification, they said, or quality control, if you like, they said to the Japanese company, we would like to order 10,000 widgets, whatever the widgets are, and we will accept the shipment if 6 out of 10,000 widgets are faulty. So a lot of companies do this. They say, we want so many parts, and the shipment will be acceptable, and we will pay for it if the number of faulty parts does not exceed X. So this company said if the number of faulty widgets does not exceed 6, we will accept the shipment. A few weeks later, they get a big box and a little box. And the little box, the big box contained 9,994 good parts or good widgets, and the little box contained 6 faulty widgets. Clearly, there was some loss in translation here. However, the little box also had a letter that said, dear customer, thank you for your order. We don't understand why you wanted faulty widgets. However, we always want to make the customer happy, so here they are wrapped separately. That is validation, is where you know exactly what is going on, and validation of computer systems. Because imagine if the widget is a pacemaker that's implanted in a patient, or imagine if it is one of those neonatal breathing machines that was recalled a couple of months ago. Babies were dying because they had this machine, and the computer system thought the babies were able to breathe using this machine, but it was not. Or worse, and I always keep this as my last example, the device that is currently catching fire inside the patient. There's a short circuit, things happen. This is not acceptable. This is not acceptable when the patient is involved. This is not, my first career, I actually used to work in a hospital. This is not acceptable. Also, when you have computer systems or any kind of regulation, think of this as a legal, think of this as insurance. Any audit or any inspection that the FDA will do is going to be used for litigation. At the end of the day, they give you citations. That's because they hope that you're going to fix things, but at the end of the day, make no mistake about it. If you don't do things right, the FDA will take you to court, and you will never win. Most people do not know that Arthur Andersen, I don't know if you remember them, they actually won the court case against the government. Nobody knows that outside of regulatory attorneys. So To me, computer system validation on the positive side is a way to take care of our patients. On the, this is the carrot, if you like. The stick is, it's insurance. It's not an easy or cheap proposition. However, the few thousand or few tens of $1,000s that you might pay for validation pale in comparison to the millions of dollars, or 4.6 billion was the recent fine of one company, or the closure of your company, or incarceration of your executives. And oh, by the way, the FDA is fairly benign. They only incarcerate executives. Countries we work with, they execute executives. So make sure, I want to make sure that people understand this is really, really important. Having said that, how do we go about achieving this amazing thing that's going to help patients and save us from trouble in the future? Validation, computer system validation, especially in 21 CFR 11, I just call it software engineering, good software engineering on steroids. And I'll go through this in a minute. But basically, if you look at any software engineering methodology, you sort of have these phases, and I'll go through an example in a minute. Often it's called a waterfall model or whatever, the iterative model, and just go around in a circle. In validation, some bright spark said, oh, it's validation, let's make it into a V. And hence the V model was born, the banded in the middle. This is actually really good. This is in GAMP 5, which is one of the Bibles right now of the computer system 21 CFR 11 compliance world, and I'm more than happy with this methodology. There are other methodologies. One of our company wrote another one of these books with the FDA, and their methodology might be marginally better, but you know what? GAMP is taking over the world, and this is really the Bible reference nobody has even heard, or people have heard of the other methodology, so let's go with this, but just think of this as an example methodology, not the methodology. This is pretty much the way that you run life, just as much as you would run software projects or any computer project. So let me give you an example of buying a car. So when you buy a car, say you would have some planning, some specification, configuration, verification, and reporting. What do I mean by that? Well, first of all, you want to buy a car. Now, you don't just wake up one Sunday morning, walk into the dealership, any dealership, and buy a car, any car. That's not how it works. You usually have a little bit of planning that goes on. For example, you say, well, I want to have my family in the car, and my family consists of my wife, 2 kids, the dog, and grandma. Grandma lives with us, okay? And grandma, well, you know what, she's incontinent. And so, sometimes we forget to give her her adult diaper. So one of the things we want to make sure about the car is that we need to have some seats that will not, get soaked with urine and smell for the rest of his little life. So you start, you have an idea of what you're trying to do. Obviously, nobody says, the car has to have 4 wheels. And actually, there used to be a car in England. It was called Robin, I think. And it had 3 wheels. So, you might want to say the car has 4 wheels, but normally we don't do that. But we might say it has 4 doors because, we really can't get the kids behind and all this stuff. It has to be a sedan type car. And by the way, because we have a dog, it's a big dog, we want to be able to put it in the back, so we either need a station wagon or an SUV or a truck, etc., etc. So this is planning. Now you start into the specification. This is where you get more specific. These are phases, by the way, not deliverables. I'll talk about deliverables in a minute. So you kind of go, well, you know, the things I want about the car is I like the color to be green. And speaking of that green, I also like cars that are electric because I want to protect the environment. And it has to be, you know, no more than, I don't know, 12 inches off the ground so grandma can get in. And let's talk about grandma. Let's go with vinyl seats because, you know, leather seats and urine don't mix well either. So that's what happens. And by the way, based on that, we can say, and by the way, I have no idea if it's correct or not. I'm just using it as an example. Let's say a Toyota Camry station wagon is the ideal car. That's what I'm going to go for. And so you go to, you get a little bit more information, how much it's going to cost. You know, you might have constraints, whatever, and you walk into a dealership. Now, you know, ideally you don't build a car from scratch, so we'll talk mostly about configuration, but if you were to build a car from scratch, you would be coding. But say you get to a dealership and they ask you things, do you want the shiny wheel rims, and do you want heated seats, and do you want, I don't know, the Bose system. So those are configuration. Now you're refining more what you need in this car. You're not just getting a generic Toyota Camry station wagon with vinyl seats. You're getting your family's, the one that will just be right for you. Toyota Camry with vinyl seats for grandma car. So, you know, the dealer says, oh, okay, you know, this is, you know, we have a model like this on the floor. Let's go for a test drive. This is where you go for your test drive and, you know, finally you decide this is, you know, maybe you drive a couple of models and finally you decide exactly the one you want. You buy the car, everybody's happy, and then you start reporting. You tell your friends, you know, I bought this car and I really wanted the leather seats, but, you know, I got a really good deal on the vinyl, sorry, I really wanted the vinyl seats, but I really got a good deal on the leather seats. And they said they can put Scotch Guard on it so we can always wipe off the urine. And by the way, I was only going to pay so much, but I decided it was worth springing up for the extra, et cetera, et cetera. So this is actually life. It's not just software. So most companies have some kind of validation methodology. And again, with a validation master plan, I suggest you have a validation master plan for the spreadsheet. And basically, you put in that validation master plan everything that you need to know about your spreadsheets. Do they need to have leather seats? Do they need to have vinyl seats? Are you expecting grandma to be using your spreadsheet? So that's the sort of thing you want to put in your validation master plan. The reason you want a master plan is the other option is to do it one by one for each spreadsheet. Why? It's too much work. Usually people start with something for one spreadsheet and then they generalize it to other spreadsheets. Also include standards. You know, think of this as a fleet now. It's not, you're not buying one car for your family, you're buying a fleet of cars. So define the standards for each sheet, toolbar, add-in, chart. Have standard testing. You know exactly what you're going to do so that you can reuse things. You know, have standard testing for the fleet of cars. You know, you're not just going to, you know, you bought one, you bought everything. You're going to have to do some testing on each car. Standards, again, for coding. And by the way, there are some risk ways to minimize the amount of hook that you do. We touched on this earlier, but let me give you a little bit more detail. Back to our friend GAMP5, which is where the V model came from. There are actually, there used to be 5 categories of software, and by the way, GAMP5 and 5 categories are completely unrelated. It just happened. When GAMP4 was around, there were 5 categories of software. Now that GAMP5 is here, there are only 4 categories of software. Again, unrelated. The categories are category 2 has been dropped, 3, 4, and 5. Most software, except for spreadsheets, will only be in one category. Spreadsheets, of course, are in every category. So in terms of risk, you can have category 1 where you have just generic application. Category 3, range operations, cell operations, some simple templates, arithmetic operators, and printing functions. Category 4, some customized functions, simple Boolean functions, complex templates, some statistical functions maybe. And this is category 5, where you play fast and loose with your spreadsheet. You can do anything you like. You have custom macros, sophisticated lookup functions, nested Boolean functions, and GASP network spreadsheet applications. If you're doing those kinds of things, category 5. Now, the FDA is very clear about the risk associated with each category, and you don't get a price for guessing that the lower the category, the lower the risk. So whatever your risk methodologies that you put in your validation master plan for your spreadsheet, make sure that it kind of matches a little bit to this. So a lower risk, you just have unrestricted data entry, some labeled text, some basic functionality, sorting, formatting. Medium risk, you're starting to care who is entering data, some conditional formatting, especially if you have alerts, maybe you have charts. And high risks, of course, you're in category mature 4 and 5. I had one bright spark say to me, well, we can redefine our risk methodology so that category 5 are low risk. And I said, great. And you think the FDA is stupid, right? You don't think they see thousands of these things, and then all you manage to do is call into question your entire company's risk methodology, not just the one for the spreadsheet. So if you want to get creative, I don't recommend it here. Bob will be very happy to come to your environment. So having said that, now the rest of these deliverables, and now we're in deliverables, not phases, need to be tailored to your spreadsheet. I'm not going to go into all the details. I'm going to let you read through the details, and I can always answer questions on them after the presentation. But I want to give you a high level of deliverables. We have requirements, and this is really the what needs to be done. Okay. Now, these are sort of in the planning side of the car. You kind of say these are the things we're trying to do. This is, the spreadsheet should tell us the PK value for this such and such, or the statistical value for such and such, or you should just have a list of our SOPs and tracking what SOPs have been completed, what people have been trained on, etc. So you have to decide what. Now, traditionally, and again, I'll refer you to GAMP5 or other webinars for user and functional requirements. You can have user requirements, you can have functional requirements. I always like having less, I always think less is more. I like to combine them into a single document that I call FERS for functional user requirements, but whatever your methodology is, do that. Most people don't know how to write requirements, and I'm actually creating webinar, not just for Global Compliance Panel, but for the whole industry. Part of my tasks as a member of the Computer Validation Initiative Committee is to set standards for the industry, and requirements are so important that this year I usually have to publish a paper in the Society of Quality Assurance and create some additional training or standards. So this year I decided I was going to address requirements. And these are categories of requirements. Again, not part of the scope of this. It's not my goal to teach you requirements, just the categories. And you can use these categories to group anything in following documents. So more requirements, again, I'll let you read them. More requirements, more requirements. But this is where the previous set is for all requirements. It's generic. Here's where we get specific to worksheets. Make sure that your requirements include, again, this is what? All the worksheets, custom toolbars, add-ins, charts, etc. For each worksheet, define expected data entry, including field names, allowable values. I had one clinical trial where a patient had been dead for 3 months, and then he turned up being hypoglycemic, low glucose levels in his blood. You know, I think if you've been dead for 3 months, you're allowed to be hypoglycemic. That's my position. That's my view. So make sure what are allowable values, like, for example, patients cannot be tested after they're dead, conditional formatting, etc. Calculations, I'll give you more of an example, output or final calculations, and then for each custom function, define names and the purpose. For each chart, refine requirements, title, access, labels, etc. For drop-downs, define the values, standards, also, etc. Once you've done requirements, now we go more into the specification phase, which is in the car. We've gone past the planning. Now we're going to specification. And this is where we get into the how. You know, before we're saying what, now we're saying how. How are we going to achieve what we want to do? This is where you decide, you know, this is going to be a Toyota, it's going to be a station wagon, etc., etc. By the way, both for any of these, please follow your company's existing procedures. If you have them, I'm not trying to tell you to change that. But you don't need to do everything. You know, who cares about copy and paste? We stipulate copy and paste in Excel work, okay? So just go for customized parts of the spreadsheet. But also describe security and then detail things like inputs, processing, outputs. Oh, security again. I call it the S word. The FDA may not understand what you're doing, but they understand security. Pre-configured drop-down boxes. Again, I'll give you examples in subsequent slides. And be very detailed about inputs. How's it coming in? Do you need to do anything? Is it automatic? Is it manual? What's the formatting? Etc., etc. Some examples from what you were talking. For example, when you define spreadsheet inputs. Don't just say, oh yeah, it's going to be, this is design, remember, now we're getting more detailed. Define the input data source or the procedure. It could be manual or automated. Put this cell range, name, title, format, other information. Data validation rules. And a good way to document this is, for example, this. You have a title, performed by, test date, and sample pH. And here you have a cell range, for example, performed by cell A2, test date is cell A3, and sample pH you will find in C10 to C20. The format of performed by is numeric. I don't ask, I don't know why. The date is in the format DD, MM, YYY, whatever your company standard is. And the range here is numeric. It has one decimal place. And the value on performed by should be greater than 2, but less than 5. The value of the date can be today or earlier. And the pH value should be equal to greater than 0 and equal to or less than 14. Sorry, I didn't quite put this correctly. But this is an example for your design specification. You don't just write some things. More importantly, calculations. Calculations are really important because they can go wrong, but also you have to make sure we can read them. There's no point giving me this, especially as an auditor or a programmer. I don't know if that's right. You know, cell F10 contains this thing. Okay, now I'm going to make you sit down and explain everything to me. So it's actually better to say, okay, cell C5 is volume, D5 is ideal gas constant, A10 to A20 are pressure, B10 to B20 are temperature, F10 to F20 are final result, and the calculation I'm trying to do is N equals PV divided by RT. So this is much clearer to document, and you know exactly what needs to happen. Define inputs for macros, defined operation, use pseudocode. Pseudocode is code. It's English explaining the code. What are the constraints? How is the macro called? When will it exist? And of course, make sure this is consistent with your own coding standards. Outputs. What are you going to do with the output? Are you going to leave it where it is? Are you going to send it to somebody? Are you going to print it? If you get a lot of them, are you going to purge them? Describe all that. Cell or range of cells that contain results, charts or outputs, copies, where they're going to go, etc. How are you going to make sure it's secure? Like I said, I can easily break into any password for Excel spreadsheet by going online. So you need to find some way to make sure that you protect sheets or procedures, etc. I'm not saying don't use password protection, just do not be lulled into a false sense of security with password protection. By the way, do not use sharing functionality. If you really need to use sharing functionality, talk to me later. It's really bad to do in Excel. Then once you've done this and you've done your configuration and coding, I am obviously not going to speak about that, you need to do the testing. And here's where we get into the Qs: installation qualification, operational qualification, performance qualification. For those of you that grew up with software, their installation qualification, this is things like system testing, performance testing, functional testing, business testing, etc., etc. And this is user acceptance testing. The problem with the FDA is they came across testing or software before they only knew about process validation, and they started using these, and this kind of stuck. I like them. I know what we're talking about. Installation qualification, you need to confirm the operating system, version of spreadsheet program. Don't just say we're using Excel. Excel what? File format, installation, input locations, output locations. Make sure your spreadsheet can access the files that you need it to access, and that all the utilities and associated functions actually work, like backup, restore, archival, etc. Then operational qualifications, write test cases for worksheets, toolbars, standards, the workflows, any compliance features, security, performance, etc. Now, some workflows will actually be tested in the user acceptance testing, and I'll touch on this a little bit later because this is very specific. Now, when you're doing OQ, I'm just going to go into a little detail over each part, but questions to be considered for input, data to be entered. Can somebody like me or another auditor or any naive user put the data into an appropriate cell? Are your validation rules being enforced? Are the formulas displayed as expected? Is the data input all through the keyboard? And if not, has the alternative data input been tested? And if the data is being imported from an external source, is it being imported correctly? For the calculation testing, is the formula accurate, and is it the one you intended? Are the correct cells used in the formula? This is a big problem with Excel. If you do copy-paste, or if you try to do several cells, Excel will try to be helpful and increment the cell number. So sometimes you have the wrong formula. So it's something to test for. If there's a range, are all the formula in the range, using the correct cells, or have some of them begun to drift? Do the calculations produce the expected results? Yes, you have to test that. And oh, by the way, can I go in and modify the formula and make a complete mess of your spreadsheet? Macros, toolbars, and add-ins. Is the function selecting the appropriate data? Do the calculations function as intended? Do the outputs meet the output requirements, and are the functions restricted to the appropriate users? Basically, input, crunch, output, make sure it's safe. For the charts, are the inputs correct? Are any calculations that you use correct? Is the complete data set being used? Are the correct columns? And are the correct units being used? Security. Are users limited to entering data into the defined input cells only? If users are able to enter data into another part of the spreadsheet that you don't want them to, can the application detect it and alert you to that? And it's a best practice in the industry that all formula cells are locked as part of the routine template test. That's something for you to consider. Performance. Now this is user acceptance testing. And the difference between performance qualification and operational qualification, usually dummy data or test data are used for OQ and real data are used for PQ because the user does not really understand the dummy data. Quite often here, in fact, almost always, you're also going to test your SOPs. So with grandma, if you had an SOP that someone needs to check her for her adult diaper before she got into the car, that's part of the SOP. And of course, you know, if she got into the car, if you were to rushed and she got in the car without the check, or she didn't have time to go back, you might need to do something to handle the exception. And make sure you have SOPs for any workflows that you have in your user requirements. A quick point about test cases, and guys, I know it's end of the presentation, but we're almost there. When you write test cases, it used to be, well, first of all, you have to write what the person needs to do, then what the expected result should be. And then there's a column for actual result. Let me start there. It used to be, and when I say it used to be, I mean a really long time ago, but I'm still seeing people thinking it's acceptable, that people would say, as expected. This went out, oh my God, at least 10 years ago, 15 years ago. The FDA does not accept that, okay? You have to, for actual result, you can do one of two things. Either write verbatim the expected result, or you can put a screenshot. I like to put screenshot when the step is for a requirement, and the rest of the time I just write the expected result verbatim. What that means is somebody needs to keep writing in this column. So if you have an essay to write, put it in the procedure and keep the expected result short. No one will thank you for having to write an essay in this column. Then when people usually say pass, fail, P or F, I like pass, yes or no. Because after somebody has been writing P or F for a couple of hours, I can't tell the difference between P's and F's. So I recommend yes and no. And of course, we also have to have the initial and date. So in summary, and some tips. This is both summary and tips. You can use the data verification to restrict data inputs to appropriate results, and you can hide your lookup tables, and you can have messages to inform users of correct inputs. This is how to do a good spreadsheet. Use formatting, use coding standards, apply protection to the workbook. Either you put in the right folder on your network and, like I said, password. Where it's practical, create spreadsheets as templates, and require procedurally that compliance spreadsheets are stored in defined network locations with IT controls to limit access to appropriate personnel. Focus on the calculations. Copy-paste, well, now it works, but you can have incorrect calculations or you can have incorrect inputs. If the spreadsheet needs to open on several workstations, make sure that works, and they're accessing the file correctly and the file is protected. And make sure you have correct integration with other spreadsheets. Workflow, where's the data input, where's the output going, what's happening with the electronic records, is it going to be a GXP record? Probably it is, that's why you're here. And with that, and a little bit over our time, I am open for questions. Before I do that, again, I wanted to know if you did not catch something that I said, please feel free to contact me. We also have a function on our website called Compliance Coach. If you have any questions, you can submit them to the Compliance Coach as well. And like I said, we work very closely with the FDA, so if we have a question we cannot answer, we might just call Bob, and we would not reveal your name, obviously, because that would not help anybody. And that's it for me. Johnson.
Thank you so much, Angela. Thank you for that. Ladies and gentlemen, like Angela just said, if you have any questions, this would be your time. What you could do is you could go ahead with your questions. If you want to directly put forward a question, you could click on the raise hand option, which is a palm-like icon on your participant screen. That way we can go ahead and unmute your individual lines. Or you could post your questions in the Q&A panel on your participant screen. And Angela can read out your questions and provide you with your answers. And if you're unable to do either of the two, you could post your questions in the chat column to me or to Angela directly, and she can go ahead and give you your answers. So if you have any questions, ladies and gentlemen, please do go ahead. And also would like to inform you all that if you do come up with questions after today's session as well, you can send your questions directly to Angela. You have her information on screen, or you could send it to us as well, and we will have them forwarded to Angela. So if you have any questions, ladies and gentlemen, please do go ahead. Angela, I don't see any questions coming up. I'll just give it an extra minute to see if we have any questions from our audience today.
Yeah, thank you. And I think, unfortunately, with my computer issue or my WebEx issue, we ran over a little bit.
And while we wait for the questions, I just want to inform our attendees today that today's webinar is available in a recorded format. So if you feel that any of your colleagues or friends would benefit from today's session, you can have them give us a call or log on to our website as well. We have a dedicated web page for Angela Bazagos, and you can go through her webinars, the ones which are available, the live ones as well, and the recorded ones. There are quite a few, so you can go through the website, go through what you're looking for, and if you find that helpful, you can make a purchase online, or like I said, you can call us as well. And Angela, I don't see any questions coming up from our attendees today, so we'll go ahead and conclude the session. But before we do, any final remarks for today's audience?
Well, again, like I say, Excel spreadsheets or any spreadsheets are low-hanging fruit for the FDA. And much as we chuckle with Bob Tollefson from the FDA, this is very serious. So I really encourage you to be safe rather than sorry with your Excel spreadsheets. And again, if you have any questions as to whether something should be compliant, feel free to reach out to us or to me. And we will always, whatever we give you will not fail an FDA audit. Let me put it like that. You can never guarantee something when it comes to the agency, but put it this way, we've worked with the FDA long enough that we've never had anything fail. So Excel spreadsheets are very important.
Thank you so much, Angela. And ladies and gentlemen, also want to remind you all that the feedback form for today's session is open in the polling area, so please do go ahead and share your feedback on today's session. This will help us gauge on how today's session went, and this would again help not just the global compliance team, but also Angela Bazikos as well. So please do go ahead and share your feedback. There are just over 8 questions, and they're all multiple choice in nature, so it shouldn't take you more than probably about a minute or two to provide your answer. So before you log off the session, please do go share your feedback. And once again, if you have any questions after the session as well, please write into Angela or to us, and we will have them forwarded. So ladies and gentlemen, on behalf of Angela Bazikos and the entire Global Compliance Panel team, I thank you all for logging in today and hope the rest of the day is a lovely one. Thank you so much, ladies and gentlemen.
Thank you, everyone. Bye.